up, everybody? Welcome back to my YouTube channel. I am Dr. Allie. I'm an OBGYN, and here on my YouTube channel I talk about all things women's health, whether it's periods, pregnancy, and even low sex drive, which we're going to talk about today. So I hope you guys hit that subscribe button and follow me along on this new YouTube journey. Recently I posted this TikTok video and it went a little bit viral. So many women in the comments were asking for more information on low sex drive, what it means, how we diagnose it, things they could do to make it better. And so here we are, and I'm making an entire YouTube video explaining and answering all of your questions. I'm trying to film a video. You're being disrespectful. Someone wanted to say hi. This is my little dog. His name's Ash. Will you say hi to the people because you're being noisy? Mommy's trying to film. Okay, back to the video. So, does having a low sex drive mean that something's wrong with you? No, but please let us know. As OBGYNs, we are trained in this, we can help you, we can talk about it with you openly. So please let us know if this is something that you're going through. Today's video, I'm gonna focus on two things because in the realm of female sexual dysfunction, there could be many different reasons why this could be happening, and that video would be like days long. So I'm gonna focus on one, female sexual interest and arousal disorder, and then secondly, pregnancy-related sexual dysfunction. So let's get to it. So to start off with a little bit of background, 43% of American women actually report having some sort of sexual problem. That's 43%, which means you are not alone. Of those 43%, 12% of women get a lot of distress from this, and it's actually a really big issue that they struggle with. Again, you're not alone, so let's talk about it. First, let's talk about a normal sexual response. We know that a normal sexual response starts with excitement or arousal, then we go to plateau, and then we have our climax or orgasm, and then resolution. And I'll put a picture of that here. As women, we know that estrogen, which is primarily made in the ovaries, plays a critical role in this normal sexual response. We know that estrogen plays a big role in our tissue sensitivity, in our vaginal secretions, in our elasticity and joint mobility. It can affect urinary incontinence. It affects the muscles of our pelvic floor. So if you can imagine, if there's ever a decrease of estrogen, it can affect all of these things. We know that as we age, estrogen naturally decreases, but there could be other things that affect estrogen. That can be surgery, medications that we might be taking. So consider those things when you start thinking about low sex drive. Let's talk about our first topic, female sexual interest and arousal disorder. It is normal for a woman's life to have changes and fluctuations in our arousal and interest in sex. This is normal. There can be many different things that affect our sexual interest and arousal. Things like whether it's something having to do with your partner, sleep disturbances, stress, the way we perceive our body and fluctuations in our body image can actually change how we feel or how we get aroused by sex. Other big things can be pregnancy, which we'll talk about later, breastfeeding, substance abuse, alcohol. All of those things are going to affect sexual interest and arousal. There are also other things that we see that can affect this, such as a woman who's had a history of abuse or rape, of genital mutilation. So if you have a history of anxiety, depression, that can play into it. Women who have other medical conditions, maybe a neurological condition, diabetes, high blood pressure. If there's some sort of substance abuse going on, like I mentioned earlier, alcohol, different medications might play into it. If you've ever had some sort of pelvic surgery, that could affect it as well. As you can tell, there are a bunch of different lists of risk factors or things that can be contributing to the low sex drive. This is not something that's like black and white, super easy to diagnose, but it's important to talk to your provider about it. Most women that suffer from this will describe The feelings of sex is more as you think about it, but in like an avoidance type of way, where it's almost shameful to think about having any sort of sexual desire or arousal. Or maybe women only think about sex because they feel it is their duty or they owe it to their partner to want to have sex. In the second half of this video, I will talk about like diagnosis and management, so just sit tight. But right now, we're going to talk about pregnancy-related sexual dysfunction. So specifically with pregnancy, there can be trauma, whether it be from a vaginal delivery or a C-section, that can be contributing to these. So like I mentioned in my first YouTube video, and I will leave it linked down below, any sort of tear, or maybe you needed an episiotomy or a small cut during the delivery, that can lead to pain with penetration or just painful intercourse. So those type of things can contribute to sexual dysfunction. Another big topic is breastfeeding. We know that breastfeeding can lead to vaginal dryness, and then this can make intercourse uncomfortable. Also, if a woman is suffering from postpartum depression, that could certainly be contributing to it. That's why it's so important to be screened, especially at your postpartum visit, for any signs for depression. This should be something that your doctor should openly talk to you about, even during your pregnancy. Now, I've written a whole blog post on postpartum depression, which I will also leave down below so that you guys can check that out. Now let's talk about evaluation and management. Whether it's from pregnancy-related sexual dysfunction, or maybe it's just an arousal interest disorder, both can be pretty much treated the same way. Now, diagnosis. As I mentioned before, this diagnosis can be challenging and requires a full evaluation. Your doctor should sit with you and come up with your history, any sort of medications that you're taking, any sort of diagnosis that you have, and together you can see if there's some sort of correlation that could be leading to this sexual dysfunction. So go see your OBGYN. This video, I can't treat you just simply from this video, but I can empower you to get the courage to bring this up with your doctor. Like I mentioned before, as OBGYNs, we are trained in this and we can openly talk about it. You should be able to live your life to the fullest, without shame, without fear. So please bring it up with your doctor and we'll sit down together and talk about it. So what's the treatment? This is obviously going to depend on what is the root or the cause of all of this. Obviously, if there's something that you can identify, like maybe it's a medication, it may be switching to another medication. If it's something that was caused by a traumatic birth experience, that might be something where pelvic floor physical therapy might be very beneficial and help you get back to a point where having intercourse is no longer painful. Now, one treatment that has been proven to work time and time again is going through some sort of psychological therapy, whether that's cognitive behavioral therapy, maybe a sex training therapy. It has all been proven across the board to help. There's one specific type of therapy called mindfulness-based therapy, and it's usually done in a couples setting, and it really focuses on stress reducing within the relationship and partnership, and really focuses on mindfulness, listening to what the other partner wants, needs, etc. Another thing could be a lack of knowledge or experience with clitoral stimulation, as we know that that really helps in reaching orgasm and climaxing as women. That's why I think it's really important to educate yourself. Be familiar with female vulvar and vaginal anatomy. This will benefit you, and it will also benefit your partner if that seems to be the issue. Now, other things you can do. Please stop using any sort of irritants, soaps, anything with scent. That could all affect the vaginal tissue and our sensitivity to it, and it can throw off the pH balance of the vagina. That could lead to some of these issues. Now let's talk about lubricants. Some women struggle with vaginal dryness, and lubricants can be a great option. There's so many types of lubricants out on the market right now, but be careful when buying one. Try to avoid any that have any sort of overwhelming scents. Anything that has alcohol in it can also be very drying to the vaginal tissue. I recommend using one that's more silicone-based rather than water-based, and if they're silicone-based, they're safe to use with condoms. Another option might be just to use coconut oil, olive oil. It's definitely a lot cheaper, and it's safe to use about 2 to 3 times per week. Anyway, that brings us to the end of the video. I hope you guys liked it and that you learned something new. But more importantly, I hope that I can at least empower you to bring up this topic if this is something you're struggling with your doctor. There should be no shame. No one should ever make you feel bad about something like this. This is our job and we're here to help you. So I would love it if you guys would share this video with your friends or anyone that you think would benefit from it. Obviously, give me a thumbs up and leave me any comments or questions down below. You guys can find me on all social media platforms, Instagram, TikTok, my blog. I'll leave everything down below, but it is AliRodMD. So give me a follow on those so we can keep connecting. Thank you so much for all of the love and support. I hope you guys liked the video and I'll see you in my next one. Bye.